Okay, let's talk about it. A serious shoulder injury, man, it can feel like you've been dropped in the middle of nowhere without a map. But that's exactly what we're going to do today. We're going to lay out the shoulder recovery roadmap.
When you're hit with a major injury like this, everything just gets foggy, right? The questions start swirling, you're not sure what's next, and honestly, it's just a lot. It's overwhelming. So the real question is, where in the world do you even begin?
Well, the best way to find your way out of the woods is with a good map, and that's what we have. Our roadmap is actually pieced together from three really solid online resources. Think of them as clues in an investigation, and our job is to put them all together to see the full picture, to get from that point of injury all the way back to strength. All right, so first stop on this roadmap, and it's the only place to start really, you gotta understand the damage. You just have to. You can't fix a problem if you don't know what the problem is, right? This right here, this is the foundation for absolutely everything that's coming up. So, our first clue, our first resource helps us nail down a definition. Shoulder trauma sounds specific, but it's not. It's actually a huge umbrella term. It could mean fractures, dislocations, a whole bunch of stuff. Just knowing that, just getting that little bit of clarity, is the very first step to feeling like you're in control again. Now, what's really important to get here is that this isn't about you trying to self-diagnose from your couch. No way. It's about becoming an informed patient. It's about arming yourself with knowledge so you know the common causes, you understand how doctors diagnose these things, and you're aware of the options before surgery. This lets you ask way smarter questions, and you'll really get why that initial, correct diagnosis is the absolute bedrock of your entire recovery. Okay, that brings us to the next major landmark on our map. And for a lot of people, this is a big one: surgery. We have to understand that this isn't just another step, it's a massive turning point. It completely changes the landscape of your recovery journey. And this comparison here really shows you how your entire mindset just flips. Before surgery, you're wrestling with these huge questions. Is this even necessary? What are the risks? You're stuck on the if. But the second you're on the other side, bam! The questions are all practical, all about moving forward. It's all about the how long and the when can I. So, our second resource is basically a guide to get you through this whole phase. It breaks it all down into totally manageable pieces. First, you've got to understand the procedure inside and out. Then you prepare, not just practically for the hospital stay, but mentally too. And finally, you got to know what's coming right after. You need to be ready for the pain, the lack of movement, and what that initial care is going to look like. And that leads us to the final leg of our journey. And honestly, this might be the most important part of the whole thing. The surgery, yeah, it fixes the broken part. But the real work, the thing that actually gets you back to living your life, that's all about rebuilding. And you do that through movement. Look, recovery is a total marathon, not a sprint, and this timeline makes that incredibly clear. Check out the progression here. For the first month, you're not even moving your own arm. A therapist does it for you. That's passive motion. Then, for the next couple of months, you finally start to move it yourself. You're basically reteaching your body. It's only after all of that, we're talking 3 months plus, that you even begin to think about strengthening. So here's the big takeaway from that. Think about it. The diagnosis, the surgery, all of that is stuff that basically happens to you. But physical therapy, rehabilitation, that's something you do. This is where you get in the driver's seat. It's the active part of the story, where the effort you put in is directly tied to the results you get out. Okay, so we've walked down the three main trails on our map, right? We've got diagnosis, we've got the intervention of surgery, and we've got rehabilitation. Now it's time to zoom out and see the big picture. See how all these pieces fit together to actually define what your recovery looks like day to day. Which brings us right back to where we started. After looking at all this, what's the one thing? What's the key factor that actually changes your day-to-day recovery and, determines how this whole thing ends up? It really all boils down to three things. First, recovery isn't just one moment. It's a whole journey with very distinct stages. You got diagnosis, then the intervention, then the rehab. Second, good, solid information is your best friend. It's the guide that gets you through each of those stages. And finally, and this is the big one, guys, your success depends on you. Your active participation, that's the engine. That's what drives the whole recovery forward. So, there you have it. The path from being injured to being recovered. Look, it's not easy. Nobody's saying it is. But it's not a mystery. It's a path you can actually navigate. This roadmap, built from these resources, gives you the clarity, it gives you the structure to move ahead with confidence. So the only question left to ask is, are you ready for the journey?